How long does it take to grieve? What if I told you forever? What if I told you that grief, especially intense grief, changes you a little bit for the rest of your life? Every experience that we have in life changes us a little bit. But if you ask me, how long does it take to get through grief? You might really be asking me, how long does the pain last? How long does the depression, the anxiety, or whatever manifestation of your grief is happening right now? And that actually needs to be a little separated from your grief, like knowing that you actually have to treat depression. I think when we talk about stages of grief, we think that depression is a normal stage of grief. Anxiety is normal. And yes, feelings of depression and anxiety are normal. But what I often see is people struggling with clinical depression, clinical anxiety, very specific anxieties that need to be treated. So I need to do a cut here because my notes turned off. So when I say that grief is forever, I'm telling you that it changes you and that we all experience grief and you will experience grief again. And maybe that's where your anxiety is coming from, that you will experience grief again. The DSM, which is the book that we use in psychiatry and psychology to diagnose, there is a diagnosis called prolonged grief disorder, which says if you're still experiencing symptoms after a year, then you can be diagnosed with this. And in several previous videos, I have kind of made like a possible 5-year mark after losing a child. But I don't want you to think that the pain is over at 5 years. The intensity and frequency in which you must feel the pain should decrease over time. But this BS that time heals all wounds is not true. You must process and feel the pain. What if I told you that time and space is not real? And this came from my own grief, a very special and endearing story about time and space. And I can tell you, my name's Christy Bundekamara. I didn't want to be a grief expert. When I started this YouTube channel after my son died, I wanted it to all be about mental strength. How do you overcome depression and anxiety? And how do you live in real world being mentally strong, even amongst pain and suffering? But here I am, a grief expert. I have experienced every type of grief. My father died when I was 10 months old. I'm thinking, I didn't really know him. That's not grief. Yes, it is. It changed the course of my whole childhood. And that is grief. I have lost all of my grandparents. You think, oh, that's normal grief. Everybody goes through that. That's true. That doesn't mean I don't cherish those relationships and cherish what they contributed to my life that no longer is there. That's grief. My first traumatic grief was when I lost a son in a drowning accident in 2005. But grief comes in all forms. Grief when my son Reggie was diagnosed with catastrophic epilepsy, and we had 10 years of kind of medical trauma and grief that my children started with, oh, they'll never marry, they'll never be able to work. And then as they got worse and worse, it's like, I'm continuing to have to grieve. I'm grieving what I wanted for my children. And I have one dear follower who talks about the grief of when you do everything that you can for your children and they're not making the choices that you want. I've experienced that too. I have a daughter who is not making choices that I think are good for her. That's grief. And if you know my story, I lost Reggie in 2016, my daughter Maya from sudden unexpected death and epilepsy in 2021, and most recently, my husband. I experienced anticipatory grief, traumatic grief, And so here I am. I am a grief expert. So how long does it take to grieve? And as I do this process and share my journey as I go through it, I realize, yes, there's the symptoms of grief, of depression, anxiety, the heaviness, the fatigue should begin to decrease. But grief will happen again. And as a country, a culture, a world, let's start talking about grief and how you actually process grief. What can you do if grief is forever and it feels like it's killing you? What can you do about that? I told you I'd tell you a story about time and space. And in the Mentally Strong Method, we kind of separate everything because oftentimes when we are experiencing something, depression, anxiety, grief, trying to process trauma, it gets all enmeshed. And negative self-talk, I begin to say I wasn't a good mother, I didn't do enough, whatever, that negative internal dialogue. We actually have control of those things. We don't have control over who we lost, for sure, and probably don't have control of who we might lose. And that's a really scary place. My biggest fear is that mothers won't want to hear my story because I'm living their biggest fear. But grief is a reality, and I hope no one, well, I can hope all I want, people lose their child every day. Not only little children, but anyone who dies under the age of 50 has a parent, probably. And so grief of a child is also a part of life, and nobody talks about it enough. So this story about time and space. If you've been following me, you know that I talk a lot about grief being a spiritual process, regardless of your religious beliefs or upbringing or even trauma. I have so many people who say, don't talk to me about God. I don't believe in God. Grief is a spiritual process, and we've got to, or you have to begin that healing from the spiritual level is to connect spiritually. And for me, it's this time and space story. When I've always been a believer in God and was taught very many things in the church that I believed. When I began losing children and having enormous stress and grief, I questioned some of the things that I was being taught doctrinally in the church. And I began to really try to seek a real, intimate relationship with my spiritual relationship, what I will call God. And in that process, the first time I heard my child speak to me after their death was Reggie, probably a couple months after he died. He said to me, "Mama, you think you're so smart, but you have no idea. I'm okay." And it was this overwhelming contentment that he was expressing to me. I rationalized that experience and didn't really have more connection after that. But when my daughter died, which was even more traumatic for me because Reggie's death was 10 years of medical trauma. There was always a fear that Reggie was going to die. And so when he did die, there was no part of me that would have wished him back to the pain he was experiencing on this earth. But when Maya died, she did not have the same medical trauma. Although she had seizures, they were rare. Although she had a neurological condition, she had never spent the night in the hospital. She had friends. She had a boyfriend. She gave so much love to others. And when she suddenly died in her sleep, the spiritual conflict started all over again. And in my meditation and trying to hear from God and hear from my children, Maya said to me, "Mama, time and space is not real. It's a limitation that you have in your reality on earth. But in the big scheme of things, it's not real." And I got this understanding. If your child was on a vacation and they were having the time of their life, and you were like home, really missing them and bored and thinking about how much you missed them, they were in this wonderful place and they miss you, but they're in this wonderful place. So the pain is for us. The grief is forever, but time and space is not real. Like they are still present, even though we feel like they're not. And I've gone through this spiritual journey and I believe this 100%, but I still have moments where I cry because I miss her. I miss Reggie. And that's grief. And I miss my husband. And there was a lot of anticipatory grief before my husband's death. He was on hospice and I've already done all this spiritual work and he comforts me, but grief changed me. I am a different person because of my loss. So grief is forever. The depression, anxiety, all of that should be getting better over time. And if it's not, get treatment. So what can you do? Here's my advice to people experiencing grief. And honestly, it's really all of us. We've all experienced grief. So acknowledging how it impacts us. It's okay to cry even 30 years later. My advice is, number one, and always, I don't care if it's 3 months after you lost your child, 3 years, or 30 years. Choose life. And those two words have a spectrum of meaning. When I say choose life, in the rawest form, don't hurt yourself. And I have other videos that talk about the intensity of the pain of losing a child can make you think of those things. But it also means choosing to grow your life without the person you've lost, without the guilt of choosing life. And it's different with losing my child and losing my husband. But I think there's part of us that wants to hold on to who we were before in some sort of honoring them. If your loved one was on the vacation of their life, would they want to hear about you being home depressed? Your person is still here. Time and space is not real. So that is number one, choose life. Whatever that means. I know someone who, it's so raw. It's only been 2 months since losing their child. And there's so much pain to process. But today you can choose life. You can choose, first and foremost, not to hurt yourself. But second, choose one thing to do. The second thing is, how do you actually do that? There's so many people that say to me, the pain is so unbearable. That's what makes us want to think about hurting ourselves. How do you choose life? I don't want to choose life. I don't care to choose life. If you feel like that, that is clinical depression. And I need you to seek treatment for that. That, I'm going to repeat myself, that is clinical depression. Don't be confused that depression is a normal part of grief. Yes, but when it becomes clinical, when it is impeding your function, which I think happens almost every time with someone with traumatic grief, that needs treatment, counseling, maybe medication. There are ways to treat depression in natural ways. It does take longer, and we'll have other videos on that. So I said, what do you need to do? You need to choose life. How do you need to do it? If you are experiencing clinical depression, anxiety, those kinds of things, you need to seek treatment. And then we need to find yourself, because grief is forever. You are a new person, and maybe you don't like that person. Maybe you don't want to be that person. None of us wanted to be the mother that lost her child, but you must find yourself. And in finding yourself, find joy. And I have tons of videos. I encourage you to just binge watch, find titles that resonate with you. But if you are struggling with traumatic grief, you have lost a child, you have lost a husband, grief seems to be the weight you can't take off. Please go binge watch my videos, click down, get some grief resources. I have a free grief course. I have an ebook. All of the YouTube is really about how do we grieve. And grief comes in every form. And I don't want you to be intimidated that my grief is so much. Oftentimes people will say, well, I feel guilty for feeling the amount of pain that I feel. It's your pain. You have to feel it. And it's not a measuring competition. I think God has allowed me to experience every type of grief so that I can shift the culture of mental health and acknowledge how grief changes us. But that depression and anxiety forever is not okay. Grief forever is okay. Join me on my grief journey, and I do believe that we are mentally strong.